What's up? Hello everyone. My name is Alex. Welcome to the Alex Show. I gotta come up with something better than that. What's up, y'all? Welcome to a mini little intimate slice of me. I wanted to sit here today and kind of delve a little bit deeper into neurofibromatosis, which is my skin condition, for those of you that don't know, and a little bit more about myself. So y'all get to, kind of see me. You don't get to see it all in them reels because, baby, I am a piece of work. Okay? Woo! But yeah, I wanted to kind of, let y'all in, kind of open the door for new opportunities to happen. So you're gonna see me looking back and forth and looking down because I do have some information that I'm going to share with you specifically about neurofibromatosis. The sources that were used in this particular presentation, I am going to post them below, student mode, and by all means, this is not meant to replace any educational content. This is not meant to be used as a diagnostic tool. This is information that you can easily Google. You can easily look up on reputable websites and scholarly journals if that's your jazz. This information that I'm using, I'm pulling from a presentation that I used for school. So those sources that I used will get posted, and I'm gonna read y'all something from the website from the Children's Tumor Foundation. I am not a doctor. I am a healthcare professional, but I'm not speaking in the capacity of one right now. I am not a doctor. I am not a nurse practitioner. I am not a specialist. I can make sure you stay alive though, but I am not your diagnostic tool. So please, if you think you have neurofibromatosis or if you think your child has neurofibromatosis, please speak with your primary healthcare provider. Had to get my little disclaimer out of the way. So yes, all that to say, you're gonna see me looking back and forth at the screen. Well, you won't see the screen, at my computer and at my little notebook, because I did have to put together notes. This is like my first in-depth YouTube video. So I want to kind of make sure I'm thorough. I wanted to wait until, I did something with my hair, and I don't wear makeup like that anyway, so that wouldn't have been my authentic self. And all this other stuff I was waiting on. Y'all say put the content out there, so your girl is putting the content out there, and I'm giving it to you literally just how it would be if you were sitting right in front of me. So let's get into it. We talked about why we're here and what's going to happen. Oh, another disclaimer, you're going to hear 3 beeps occasionally in the background. You might, I don't know, I'm gonna have to go over this video and see if I hear it. But you're gonna hear some beeps. It's not your microwave. It's not my microwave. Don't worry about it. Just try to live with it as I have for the past couple of years. You hear it? Don't worry about it. I promise it's nothing. Nothing is in the microwave, y'all. Nothing is being cooked right now. So, neurofibromatosis is actually a very mysterious yet intricate disorder. Is much deeper than what you see with me. I know a lot of people in my comments have said that, like, my reel is the first time that they've ever seen anybody, that looks like me. So clearly the awareness is not out there. But it's much deeper than just what you see with me. It's a very complex disorder, and it could cause some very, very, very trying issues, and we're going to get into those. So I kind of want to, explain the depths of neurofibromatosis too. Like I said on the live that I did on Instagram, I always kind of compare it to diabetes in the sense that, you have with diabetes mellitus, you have diabetes type 1, you have diabetes type 2. And with neurofibromatosis, you have neurofibromatosis type 1, neurofibromatosis type 2, and then you have something called schwannomatosis. So, according to the Children's Tumor Foundation, it's on their website. You literally can go and look this up, and I will post the link. It says, how does someone develop NF? So that's a big question that I get. How did you get it? So it says half of the people who develop NF1 or NF2 inherit it from a parent. The others develop it by chance as a result of spontaneous change in a specific gene in an egg or sperm cell. So it's genetic. It has everything to do with your genes. People say it's a curse. People say it's a bad diet, it's your genes. So either your parent is going to give it to you, or like I have had some people in my comments also tell me that their child has just been, diagnosed with NF and they've never heard of it before. So it really can happen both ways. In my case, it was genetic, and I'm gonna try not to get too much into me because we're gonna talk about me a little bit later. I'm gonna just give you this, little education tidbit. So, boom. Every person affected by NF1 or NF2 has a 50% chance of passing the condition on to their offspring. Can NF be cured? That's another question. Does it ever go away? At this time, there is no approved cure for NF, but a number of promising NF clinical trials are underway. Right now, they really are going full steam ahead, at least in trials with children that I've seen so far. And it's clearly on the Children's Tumor Foundation website. But they are starting to kind of gain momentum in this particular area. So it says, as researchers continually learn more about the underlying causes of NF and what makes tumors grow, we get closer to the development of effective treatments for NF. This is why it's so very important for you to keep up with your doctor and see your doctor to get, advice about the progression of the disorder and, the treatment plan, what you guys are going to do. If you are, going to change your diet, because sometimes certain diets do contribute to the growth of, tumors, regardless of what type of tumor. I put together a presentation for nursing school. And of course, me being the only person in the class with neurofibromatosis, and some of my classmates had never seen this before, I had to choose neurofibromatosis. So we talked about neurofibromatosis having pretty much 3 different types. So neurofibromatosis 1 occurs when there's a mutation of the NF1 gene on chromosome 17. Come on, let's get into this education, y'all. As it progresses, it affects multiple organ systems, including the skin, the heart, and the vascular system, the eyes and the ears, the body as a whole. NF2, marked by variations in the NF2 gene on chromosome 22. Ocular and neurological deficiencies may be diagnosed. We're going to get into that. Schwannomatosis is caused by independent mutations of somatic cells that affect both NF2 alleles. Now, like I said, this is not meant to be like super educational. So all of those sciencey and biological terms and stuff that we just said, if you don't understand that, you're gonna have to Google it. Okay. NF1, we're gonna go back and dig a little bit deeper into that. So early signs of NF1, and honestly, at some point, like all of them kind of merge. So the manifestations of one could very much so be a manifestation of the other. So just because it's in NF1, this could very well so happen for people with NF2 and vice versa when I get to that part. So the cafe au lait spots, which are what people describe as like little freckle looking spots, and some of them, I still have some for the spots that aren't raised. That's what I guess you would consider a cafe au lait macule. So like I said, freckle-like spots. That's the early sign. So that usually shows up in children. That's what my daughter has right now. And that's how it started out with me. And I do have a couple of people like in my inbox that's like, or in my comments that kind of describe theirs that way also. Later signs, and these are extreme signs, but later signs could be learning and cognitive impairment, ocular problems, spinal deformities, and even hypertension. Because now, mind you, they're tumors, they're pretty much growth. So whether they're growing outward or especially if they're growing inward, and these tumors grow on nerve endings. Nerves are literally everywhere, all over your body, everywhere in your body. So if they're growing along your spine, you can imagine, like, of course it's going to cause, some problems that could cause scoliosis, cysts, pain just from having, growths on your spine. They can grow on the nerves in your eyes. So of course it's gonna cause vision problems. Y'all see what I got on? Because I can't see. Learning cognitive impairment, like it should all be kind of making sense to you now. So there are people that really like deal with some very serious issues surrounding just physical, like medical issues surrounding neurofibromatosis. We ain't even get into the psychological part, which some of y'all contribute to with your comments. We'll get into it though. Manifestations of NF2, cafe au lait spots, different types of, I hope that didn't mess up anything because my battery going dead. I'm not going to get into like these different names of the growths or tumors, but different types of tumors that grow in the same spots. Visual disturbances, increased intracranial pressure, auditory issues, peripheral neuropathy, weakness or sensory loss, that numbness, tingling, feeling in your extremities, pain. And schwannomatosis, the hallmark sign of schwannomatosis is pain. Usually diagnosed between the ages of 20 and 40. And according to the Children's Tumor Foundation, 9 people are born with schwannomatosis each day. That's a new patient every 3 hours with schwannomatosis. So, y'all heard my stomach? So how do I figure out if I have this? What do the doctors do to let me know if I have neurofibromatosis? You can get MRIs, CAT scans, X-rays, genetic testing and biopsies done to confirm a diagnosis of neurofibromatosis. In order to get any of these things, you have to go to the doctor. You can't just go anywhere and say, I want an MRI. Like, you gotta go to a doctor, baby. You may get like referrals to monitor like your cognitive development, behavioral development, any psychological disorders, which we're going to talk about, because that's a whole nother manifestation with all of them, is the mental trauma that comes with having neurofibromatosis, which I guess is more so what I had to overcome, and still put in the work to make sure I don't go back to, dark places. But yeah, that's something else. And of course, they're going to make sure that they're monitoring, central nervous function. What can you do about it? Since you can't get rid of it, what can you do about it? Surgery is one of them. A lot of people ask me, can I just chop them off? That very, very much so may be the case for a lot of them. You can get chemo in some instances, certain types of, medication. They're trying out different types of medications to see, what's going to help either reduce the size of the tumors or just inhibit their growth at all. One symptom that we kind of talked about but didn't really go into comes along with neurofibromatosis is the psychological issues like depression, anxiety, PTSD, social issues, not feeling confident enough to be outside, not feeling confident enough to go to a restaurant, and then especially now with monkeypox popping up, being afraid to be possibly embarrassed and kicked out of a restaurant, not exerting yourself on social media, or not really, being able to be the person that you really feel like you are. And we have a lot of talk these days about people being able to be who they are and express themselves, the way they see fit and just living their truth. But do we really allow that? We talk a lot about body positivity and, body shaming and all of that other stuff when it comes to size. But do we really practice inclusivity? 100%. It's like each demographic has their own agenda or has their own, not agenda, I don't want to get into stuff like that, but they have, they look to protect themselves and not really at the whole scope of the issue that we're talking about. People with skin issues and just people outside of the norm, anything that's deemed not normal, should be included in that conversation. So it shouldn't really be something foreign. It shouldn't really be difficult for people to be like, okay, I know what that is now. Like, I have an awareness of, what that is now. I know it's not contagious, if that's what you need, it shouldn't be that difficult to transition from being ignorant about something to, accepting it for what it is. So the psychological part of it all is really kind of layered, because this, as much as we kind of don't want to talk about it or you kind of don't want to think about it, this, how people look really affect every area of their life. Every area of your life. I've sat in countless interviews knowing I'm more than more than qualified for the job. Resume is on point. Wouldn't have got called in, you know, if it was any other way. But I've been turned down from so many jobs. And you know, you get that email, oh, we want somebody else, questions, blah, blah, blah. I know why I was denied for this position. You thought one thing, but when I walked in the door, I looked the way that I looked, and I don't fit, I guess, the aesthetic of whatever you're trying to sell. So that was that. I'm thankful for my last 2 jobs before my nursing job, because I really feel like they really stepped out there and gave me a chance, regardless of what customers would think, regardless of what anyone would think. Here was someone, a young single mom. I can't even get into the times and into the ways that, you know, people can be cruel. People can be cruel, especially, you know, growing up where I did and when I did. You know, we didn't have all of this, you know, where neurofibromatosis could become so visible so quickly. I didn't live with my dad. We were close. He lived in the same city and I would see him often, but I didn't live with him. So I didn't have that constant visual of somebody that looked like me. I didn't have that constant pouring into concerning, you know, my neurofibromatosis. Like, my family has always been, you know, I don't see it, you know, I don't see that when I see you and, you know, whatnot. But I think the little girl in me, like, at this point, I'm appreciative of it, but I think the little girl in me needed somebody to validate that much more often than it happened. And I didn't get that. So I kind of was left to deal on my own. Me not really understanding my own body and what was going on and why this was happening to me in the first place, because I had brothers that didn't have it, so I just didn't understand, you know, why it was happening to me. And then to get, you know, picked on about it, like, I'm like, y'all, like, you act like I wanted this. You act like I want to look like this. So, like, years and years and years of that. And just years and years and years of feeling looked over because of how I look. You know, people don't want you on their team. People don't want you to sit at their lunch table. At least the people that you want to sit with, they don't want you to sit at their lunch table. You know, you got to kind of do a little bit extra, you know, to be seen and to be in the spaces that you are in. You got to, like, kind of some way, somehow show people, I do have a bomb personality. I feel like I'm beautiful on the outside too, although you don't see that, but I got to show you that, like, I'm cool to be around, you know, so somebody can hang around me. It just gets really lonely, I guess. And I will say I have been blessed to have friends, you know, all the way, elementary school, middle school, high school, you know, just, you know, even if it was a small group of friends, I have been blessed to have some type of friends all the way throughout. I don't think people, or maybe people do understand, like, your words can hurt. Your words really can affect people, and it be the main ones talking about manifesting and affirmations and speaking life. Like, yeah, you do that over your life. Do you not think that those same words, those that come out of that same mouth, you know, have power in a negative sense too? Like, come on, y'all. You got to do better. So for a long time, like, the person that y'all want me to be today, I was that person that would get all riled up at comments, y'all with these throw up emojis and all of this other stuff. It's pretty comical now. Like, it's little teenagers, like, or people with no picture in their profile or private profiles or whatever. Like, y'all are not real to me. And I think that's really what, like, keeps me grounded, I guess, right now. Like, these people are not real to me. And if you gonna be on social media, like talking to the people that look like me, talking to the people with any type of skin issues or whatever the case may be, if you gonna be on social media, people gonna talk. You make your profile private. Don't accept everybody as your friend. If you want to stay hidden, then you're gonna stay hidden, and that's just gonna be the life. You can't complain about the life that you have. Now, if it's not your cup of tea, which I won't be everybody's cup of tea. If it's not your cup of tea, then it's not your cup of tea. You know, preferences are preferences. That's what we have them for. If you wouldn't date me, that's fine. You don't. You don't date me. And you won't have to worry about it because I'm locked in for life. If you wouldn't have a friend like me in your friend circle, it's fine. I'm not your friend. And it's really, honestly, not too likely that, you're going to see too many people like me, anyway. It might be like a car. You know how when you get a particular car, when you rent a particular car, you don't never see that car until you in the driver's seat or until you in that car. So it might be like that now. You ain't never seen nobody with neurofibromatosis before, but now that you've seen me, it's going to be everywhere. So now you got to choose how you're going to respond to people. You got to choose if you're still going to be an asshole or if you're going to make you a new friend. That might change your life. That might be a forever friend. That might hold you down longer and more than the people that's already in your life. So, I don't know. Life, as I know it now, life as an adult, it's a blessing. Like, I could complain, but I won't. Because really, if I'm really, really honest about my life, God has truly been good. That's why I'm not in no fight, in no type of pressure to pray so hard, to have this taken away from me. It is what it is. It is what it is. I have an amazing support system. I'm moving forward with my life and the things that I know God has called me to. I'm excited about life, and I'm excited about where I'm headed and about where my family is headed and just the doors that are being open for us. It's real out here in the field. And even on my social media, like, you can tell that people love me because they will come through. And even the strangers that, go and sit for tat with some of these people on Instagram, I really appreciate that. I really appreciate it that you have sense enough to not be so judgmental, about something you don't know, and that you're bold enough and that you're willing to, like, stand in the gap for a stranger. You willing to take some blows in order to kind of, protect somebody else or to stand up for them. So that's real big of y'all, and I'm very appreciative of that. Let me know, y'all. DM me on Instagram. Comment below this video if I put it up on YouTube, and let me know, like, what do you want to hear me talk about? Because I can go, okay? I be talking trash about Tony, but baby, I can talk sometimes. So just let me know, what it is that you want to hear from me, what it is that that you want to see from me. Make it known so that I can tailor this stuff to fit your interests and keep you informed, entertained, all of that good stuff. I don't know where else to go from here. So we're just gonna call it a day. I had to let my phone charge for a minute, then it kept cutting off on me because my videos was long and I ain't had no space in my phone, and it was just too much. So, man, y'all really got a good, like, intimate, piece of me, because I'm pretty confident, you know, but there's work, you know, that's still being done. And just me sitting this close to the camera, me doing this in a video like on my phone camera instead of through Snapchat or Instagram to see myself through a filter first. I'm probably still gonna throw a filter or something on this or something, I don't know. But just, you know, sitting here like this, being up and close and personal, letting people really see me, intentionally wearing this so that, you know, you can see I'm not going to be dressed like this every time, you know, I'm on camera or whatever the case may be. But just kind of being intentionally vulnerable. Y'all getting it. So, you're welcome. Just like Erica, I'm an artist. I'm sensitive about my I can't be a little sensitive sometimes, y'all, so don't be hating on my flow. You know? Hopefully y'all don't hear the outside noises too much and the beeps. The beeps didn't too much distract you. This isn't like as structured as I would have liked for it to have been. This is my first time like actually putting together something like this, so please do expect things to get better. Thank you guys so much for tuning in. Like this video, share it, subscribe to our channel so that you can keep up with all the great things that we have coming up for you. Follow us on all of our socials. I will post them below. Yeah, y'all gonna be great.